Hello, today we're going to talk about breast reconstruction, and on this topic we're going to talk about DIEP, which basically means using your tummy to make a breast. When you have a mastectomy, the breast is removed and it leaves a pocket, and in order to fill it, one of the options is to use your own tissue. It's called a flap. A flap means that it's got its own blood supply and it's a living tissue. One of the options is your tummy. It's a popular option because the fat in the tummy is quite similar to your breast fat, and it's soft and malleable and grows with you and gets bigger and smaller with you. So it's natural and it's soft, never as good as your breast, but it's quite similar to your breast. That's why it's become one of the most popular flap options. However, in order to do that, you need to have enough tissue in your tummy so that it'll be adequate to fill the gap that you have after mastectomy. You also need to have good blood supply to that area, and we do that by doing a special scan called CT angiogram before the surgery to make sure that's adequate. It is a complex surgery, but we're used to it in most good plastic surgery centers. It does mean that it has a failure rate of about 3 to 4%, and also it means that we have to take the tissue away from your tummy. Most people like it, but the downside to it that it will leave a scar around the groin line. The other risk of surgery includes having a potential hernia in that area, and also the fact that you probably need adjustment in the same breast or in the opposite breast, as the reconstructed breast is always perkier and higher than your current breast in most people. Your nipple sometimes is kept, sometimes it's not kept. Again, that's a discussion we need to have together with your breast surgeon from the oncological point of view. You'll be in hospital for about a week or so, and it will take about 6 to 8 weeks recovery from that. You will hear more about that later. It's a good option. It's not available for everyone. If you don't have enough tissue, that's the commonest issue about it, or if you're particularly overweight. Again, that makes the operation unsafe in some cases. And that's a discussion you can have with your plastic surgeon.